to the room.
Hello,
Hello.
I'm Dr. Gafar, one of the doctor here.
Nice to meet you, Doctor. I'm Mary.
Hello, Mary. Is that okay? I call you Mary.
Yeah, that's fine.
Okay. I understand you're here regarding John.
Yeah.
Can you please tell me how you're related to the John?
Well, I'm the mother.
Okay. Can you please tell me the date of birth or age of the John?
Yeah, John is 3 years old.
3 years old. Okay. Mary, please tell me more about that. Why you're here today?
Yeah, well, Doctor, John is not behaving like my other child. Like he's not interacting with anyone. He's quite shy to talk.
Okay.
Yeah.
He's quite shy to talk. Okay.
Yeah.
It's not like your other child.
Yeah.
Okay. Can you tell me a bit more about that when you say it's not like other childs? So specifically, what's worrying you most?
Well, the behavior is quite different. He's not interacting. He's not. If I'm calling him, he's not listening to me.
He's not listening to you as well.
Yeah. And he's not talking as well.
He's not talking as well. So he's 3-year-old. So is that happened before as well, or it's a gradual thing?
It's there, like, he was fine when he was 1.5 years old, and then gradually he's like quite lost.
Okay. Quite lost. Have you taken any help from any of the health professional before?
No, I was like, it's fine for me. Like,
Okay.
it's fine.
Well done. First of all, you came here today. You're speaking about your child. I highly appreciate that. We'll try our best to find out what's going on. So let me do a quick summary. You mentioned that from the last few months, you're feeling that your child is not behaving, not interacting with the child. Have anyone else noticed that?
Yeah, my husband is also like that.
Your husband noticed that. And by any chance, anyone else who come to the home or your child go anywhere else who noticed that?
Not exactly, but I'm just quite worried because I'm bleeding nowadays. So
okay.
I'm like, I have no clue why he's like acting like that.
Okay. When you say acting like that, can you please specify a little bit more about that?
Yeah. As a doctor, my other son, he's like, he's quite talkative.
Okay.
While he's on that same age, but like, for John, he's like.
That makes sense anyway. Yeah. So let me ask you more question about that.
Yeah.
Any significant event happened before all of this started?
Well, no, doctor, we are a happy family. Okay. Everything is fine.
Okay, that's totally okay. Have you noticed that John do repetitive tasks, anything like repetitive phrases he speaks?
Oh yeah, I can say that, like, he's doing similar something like that.
Okay, that's fine. So before I ask you similar question, I just want to make sure everything okay with the John. John is here with you?
He's in the next room.
Okay, in the next room. He's eating well and drinking well?
Yeah, he's fine.
Wee and poo, everything okay?
Yeah.
That's quite reassuring then. Okay. You mentioned is do the repetitive phrases. By any chances he keep playing with the similar toys?
Yes.
Okay. And when you call his name, so will he do the eye contact with you?
Not exactly. I can't say that. No.
Mm-hmm. By any chance he shouts more than you?
Yeah, but when he wants to say something and he can't speak.
Okay, by any chance he's very choosy of something like any room or?
Yeah, sometimes.
Do he like colorful lights?
No, doctor, no.
Do he like any specific toy?
Yes, I can see.
Okay, when you give him some task, he able to finish that task on time?
Well, he's not that interactive, doctor.
Okay. Do you think like he's very hyperactive or something like that?
No, doctor.
Mm-hmm. That makes sense. Well, thank you very much for answering all those questions. So a few questions about his milestones. When he started walking, at what time in the same age?
It's like after 18 months.
Okay. Yeah. Regarding talking, he was having any speech delay?
Yeah, he is, and I'm quite concerned.
Okay, that makes sense. Definitely. Well, thank you very much for answering all those questions. Now, thinking about general health, about your pregnancy. So everything was okay during the pregnancy?
Yes, doctor. Everything goes well with me.
Everything was okay with the pregnancy. After pregnancy was okay as well.
Yeah.
And the birth was normal on time?
Yeah,
Okay, no C-section, nothing.
no, it's
Good.
normal.
And regarding the immunization, are you happy every immunization is done?
Well, it has been done, but I'm quite concerned about vaccination as well.
Okay, you can.
Because one of my friend, she told me that autism,
Okay,
like
okay.
something like related to
Oh,
my son is like
okay.
not talking at all. I'm just concerned.
Okay, I will come back to that anyway. Don't worry.
Yeah.
And are you happy with the development? Good about the book of the red book of the
Yeah.
good to know about that. Who else stay with John?
My husband, my
And
one of my child, and
is he go to nursery?
no, because he's not talking.
He's not talking. That's why I don't go to the nursery. Okay. Do you think any stress at home at all? Or
Doctor, we are a happy family.
okay. Well done. Thank you very much. That's a good thing. So, any medical condition runs in the family or?
No, not significant.
Okay. So at this point, ideally, I would like to examine John. Okay. And what you have told me after having a chat, Lita, I'm suspecting a condition we call autism.
Doctor, really?
Let me, first of all, don't worry. At the moment, I'm suspecting. To confirm it, I need to refer John to the specialist team, the group of doctors.
Okay.
They would assess your child and may confirm it. But before that, I would like to know that how far you know about autism.
Well, doctor, very little bit.
Let me tell you, it's a spectrum of diseases.
Okay.
A spectrum of condition. I won't call it disease. Okay. It's basically your child. If it turns out to be autism, it's not a disease. It is basically a condition in which your child is little special, which is related to behavior and communication. Okay. In the best case scenario, if it's not autism, it would be treated with the speech therapy and everything. But in worst case scenario, if it turns out to be the autism, I would like to tell you there are a lot of support groups and a lot of treatment options for that. Okay. Like you are struggling, you need support for that. Definitely we'll give support to the parents and child as well. Okay. You want to hear?
Yeah.
For example, child might need to have a speech problem. Okay. They might have some special need for studies. First of all, we'll send them to the normal schools. But if they need special requirement, we do offer that as well, if it turns out to be autism. Okay. So I will refer you. You will be seen by the autism team. Is that be okay? You're happy to go that?
Yeah.
And Lita, you're here with me?
Yeah.
I would like to give you reading material to know more about autism, what it is. Okay. And I would like to follow up with you. Okay.
That's fine. Doctor, we can continue.
Yes.
I have one, one concern that is it related to?
Yeah, autism.
Yeah.
So the autism, that's a good question. But let me tell you, there is no connection between autism and any vaccination. There is no research. Every vaccine is same. It's safe. It's not related to the autism. I want to reassure you.
Okay.
It is something not related to the vaccine.
But doctor, he got his first vaccine in his 18 months, and since then he's not talking.
No, yeah, that makes sense. But I want to reassure you that a lot of research has been done. There is no connection between. It's just a myth.
Okay. Thank you, doctor.
No.